since we are, I'll then introduce myself one more time. My name is Edson Pruka, and I warmly welcome all of you to our Thursday Health Talk session. We do these sessions every Thursday as a Norland family, and I would like to welcome all of you that have logged in, both the Norland business partners and our invited guests. Welcome and welcome again. Let me take the opportunity to invite and introduce to you our guest speaker. This lady is not an ordinary lady. You have seen her, you have heard from her, or if you haven't, then this is a great opportunity for you. She holds a master's degree in education, planning, and management from TIM University. She also holds another master's degree in public health from Kampala University. She holds a postgraduate diploma in education, planning, and management, again from TIM University. She holds a bachelor's degree in social works and social administration. She holds another bachelor's degree in nursing, again from Kampala University. She holds a diploma in sonography from Tanias Jefferson University from US, but of course from the Uganda branch. She holds a diploma in midwifery from Mutorele School of Nursing. She holds a certificate in professional health and safety, a certificate in midwifery, and she is the executive director of Kadoth Reproductive Child Health Initiative. This is an NGO based in Western Uganda in a district called Rukunjiri District in southwestern Uganda. Ladies and gentlemen, permit me to introduce to you our guest speaker, a very experienced and passionate lady in reproductive health. Our dear friend, Annette Namara. Are you here? Allow me to call you Dr. Annette. Please, Dr. Annette, give me a thumbs up or just raise your hand so that I can unmute your microphone right away. Dr. Annette, are you here? Please give me a thumbs up or just raise your hand so that I can unmute your microphone. Okay, just hold on a minute, dear friends. Let me reach out to her and find out if she's on the call already. Okay, ladies and gentlemen, please just hold on a second. Doctor is joining us. I'm trying to connect.
That is disturbing us.
The network isn't good. Please just hold on a moment, dear ladies and gentlemen. Annette will be joining us. She is actually on the call, but we're trying to unmute her microphone. Please stay on the line.
Kanzije nkuweereza amaze mupempa.
Okay, please, friends, just hold on. I am trying to help Annette. I'm really trying to help. Her network is playing a lot of games, but we are trying. I think you can hear her on the phone.
What? I don't know what is happening.
It's okay. Don't worry. Don't worry. We are going to.
With its own challenges.
Don't worry. We're going to fix it, please.
New one.
Okay, friends, we are just about. All right, Dr. Annette, finally, you're here. Finally. Oh, God. God is grateful. So, ladies and gentlemen, please join me and give her some flowers. Annette Namara is finally here with us. Please, let's welcome on stage Annette Namara. Give her some flowers. It's been a battle, but she's finally here. Annette?
Yeah. Thank you so much, Andrew. It's because I stay down, far away down in the Western Rift Valley of Uganda. The network is a problem. I think even the network. And
But
my
we can
phone
hear you
has
now.
been struck by electricity. It's not in a good condition, but please bear with me. I love
So sorry.
everyone.
We can hear you loud and clear. Now we can hear you.
Yeah.
Welcome. Please you take over from now. You can start your presentation.
Thank you. Tonight, we have delayed for some minutes, but sometimes those things happen, but take heart, and I'm sorry. Forgive me. Our presentation tonight, we are talking about uterine fibroids, which is the biggest challenge we are seeing today as our daily bread, especially for us who do sonography or scan. Out of 100 ladies of reproductive age, at least when you do you see 100, you find 30 with fibroids, and it is still a challenge. But thank you, Noland, for making sure that at least even when there is no hope, you have restored a hope. Thank you, Mr. Pulika, for the first introduction that when a lady is sick, the whole community is sick. Because directly from the Bible, a woman is the chairperson of many things. So when the chairperson has troubles, then everything is troubled. Even the petty cat at home is troubled. So thank you, Noland, for this great thinking and a solution to many problems for tonight. Let us look into that and see the good news from Noland. Look about fibroids, what are they? Then look at the predisposing factors, the signs and symptoms, the complications, and management as per Noland management. Thank you. What are fibroids? Simply, fibroids are masses. They are uterine masses, commonly non-cancerous, that grow in the uterus or around the uterus. They can be inside, they can be outside, but wherever they are, so long as they are affecting the uterus, they are called fibroids. They develop from muscle layers of the uterus. When they are from muscle layers of the uterus, we call them myometrial fibroids or intramural. These fibroids usually come through many causes, but let us look at some of them. We may not exhaust all, but we have a list. Usually because of these tumors being in the uterus, in some people, they just feel pain, and they can't tell what they are, what is happening inside, not until they either grow too big or become so painful, or when somebody is diagnosed with fibroids without even knowing that she had them or she has them. They can be very tiny, like a seed, or grow as large as a pregnancy. But the difference is that when they are so big like pregnancies, the pregnancy can't be delivered. It remains there, and usually on touch, they are very, very hard. They are very hard on touch. Some women have one, and others even come with multiple fibroids in the uterus or even outside the uterus. You can find when one has some in the uterus, others outside the uterus, others in the muscles of the uterus. These fibroids are very dangerous, that they can even cause issues with fertility. They can cause issues with bleeding. They can cause issues by growing into a cancer. So they can cause a lot of things. And we have to look at that. Uterine fibroids are of type. We have those that grow into the muscle. We have those that grow into the uterine cavity in the center of the uterus. There are those that can grow outside the uterus, and there are those that can be just attached with the stalk, and they are called pedunculated fibroids. Looking at the risks of fibroids, there are so many risks. The predisposing factors, I called them the predisposing factors, and or any other factors that can make somebody be a risk taker. Number one is a family history. Some people have them in families. They something from the family. The second one is hormone imbalance, especially those with high estrogen levels. Then some of the women come with fibroids when they are age-related, usually between 30 and 45. Oh yeah. So we also have early onset of menstruation. We call it early menarche. How does this one come? When one starts menstruation at an early age of 10, that means that this person will be predisposed to high estrogen levels for so many years, hence leading this person to getting fibroids. Then we have obesity. Obesity is the overweight. So many people with obesity usually present with high levels of estrogen that does predispose them to uterine fibroids. We have nulliparity, or those people who have never given birth. After failure of the uterus, the babies, it forms these fibroids as an alternative. That is for layman's understanding, but this is the truth that it is common in people that have not given birth. So if you have not given birth and you are between the age of 30 to 45, the chances of getting uterine fibroids is higher than that one who has given birth between that age. Then we have dieting. People with dieting that has high levels of iron, especially red meat and low vegetable intake, can also predispose this person to getting fibroids. There are so many causes, but for now, let's take those and let's go down and look at what could be the signs and symptoms of fibroids. How can I suspect myself as a person who could be having fibroids? Which ones are the common ones? So many people take long to know that they have fibroids, but these are the signs and symptoms, the common ones. Number one is menstrual bleeding, which is heavy. Menstruation is not the same in different people, but when the weight of the bleeding is big or heavy, then that can signify, or it shows that there is a query within your uterus. Then please make sure you rule out whether you have the fibroids or other causes, underlying causes, not the fibroids. Then we have prolonged menstrual periods. When the normal days should not exceed at least 8 days. When you find yours have gone as far as 10 days, 15, then there is a problem. There is, again, we have painful periods. Usually periods are painful, but for this case, when they are so painful that a person cannot get this shivering, the temperatures goes high because of that pain, some go in shock, then suspect a problem in relation to other signs and symptoms seen. We have pelvic pain or pressure, whether you are in menstruation or not. These people usually, they feel something heavy in their pelvis. Some may not even be able to hold urine. Some feel as if there is something that is pressing down there, and usually they don't know. So make sure you try and confirm whether you have fibroids or other causes of that pelvic pressure. They also present with low back. Low back can come even in other cases, especially gynecological or obstetrical causes. But for some cases where there is no pregnancy, where there is no infection, but you still feel that backache, you are likely to be among the group of people with fibroids. Then we have frequent micturition. Because of the pressure and because of the reduced capacity of the pelvic cavity by being filled by fibroid, here the urinary bladder cannot hold the urine that is supposed to be in that in the bladder, for a certain period of time. So you find that even the little urine that goes there, you keep on going for urination. It can come even, it can be there even due to other causes like urinary tract infection, those who due to hormone imbalance and other causes. But in case you have that, then first confirm whether you have fibroids, then we deal with them. Then we have constipation. Constipation is usually due to pressure that is exerted by a big fibroid in the uterus, and it is commonly found in people with pedunculated fibroids, whereby the fibroid sits between the urinary bladder, the uterus and the rectum. We call that space posterior cul-de-sac. It is between there. So the fibroid sits there, or when the uterus just excites and reduces that space, then the chances of getting constipation are high. So constipation should not be taken for granted, but you have to rule out the cause why you are getting this constipation. Then pain during pregnancy, rather intimacy. Some people during that time of happiness, they feel pain when the uterus is like being moved up and down, though so in most cases it is gentle, but for this, when there is a fibroid, this person feels pain. Then we have enlargement of the abdomen. For those who fail to know that they have fibroids, because some people have always mistaken fibroids to be pregnancies, you find her even putting on a maternity dress, thinking she's pregnant, but when it is really an enlarged fibroid, and it can even enlarge, and it bulges the abdomen. So when one feels or is experiencing an enlarged abdomen, hard, when you touch on it, it is usually hard, sometimes irregular and of unknown cause, and she's not pregnant, those are likely to be fibroids. Please run and confirm. And they tell you so that we can manage in time. Then we have fatigue due to blood loss. Because usually fibroids, when they reach a certain level of regeneration, there is a level a fibroid can grow to, and the blood vessels fail to supply enough blood, and some parts of the fibroid can start dying. When they start dying, these dead cells and tissues start dissolving or getting out or dropping out, and you find somebody bleeds heavily and for a long time, and this can lead to loss of too much blood. You find this person has anemia, and this person is very weak, has low blood pressure, has high pulse, or the heart is beating rapidly, and all other signs that are too complicated for one to stand. They also have difficulty in conceiving. Depending on where they are, some people can conceive, others can't. And this can also be a sign that one should go and confirm whether the cause or the causes of failure to conceive do include the presence of uterine fibroids. Then we have miscarriages in most cases, and this is the commonest, especially when the fibroids occupy the space where the fetus should be seated, or where the fetus lies in the uterine cavity. Now let us look at the management of fibroids. Management of fibroids depends on how big they are. It depends on whether one has the capacity, but I believe most of us have the capacities, because even if you don't get what is necessary, the situation can push you to a level that you can even look for other means to find something better than the other. Usually, when we consider the size, when we are managing, we consider the size, we consider the location, we consider the time, we consider the availability of the services that can help you. All this must be done after having confirmed and diagnosed that one has fibroids. Fibroids are the, I can call it a catalyst or something that can start somebody's brain and changes the thinking and changes the plans and disorganizes one's table of planning. So when you think you have fibroids, go for diagnosis. Usually what is done as diagnosis or during diagnosis to confirm what is happening, they are diagnosed according to history. You tell them what is happening, then they suspect. After suspecting, they examine and touch, but still that is not enough, because anybody can get other masses in the abdomen. Then we do ultrasound scan to confirm. They can also do MRI. It is also an investigation that can be done to confirm. We can do hysteroscopy. Here they put a small, they use this procedure also to confirm. Let me go rush so that we may not appear as if we are in a medical class. Then laboratory tests can be done to confirm maybe how much blood you have, which type of blood you have, so that in case it is necessary, then something can be done. We have ways of removing them. When they are too big, usually the uterus can be removed with the fibroids. When they are small and reasonably not so big, reasonably small, they can be removed, and we maintain the uterus. But here the problem is, when they remove them and we maintain the uterus, there is a likelihood of them coming back. So what is done here? In Norland, what is done, we improve we improve a line of things under Norland. Number one, we have to give pads. These pads are given to people with fibroids. They have a drug and a mechanism that can make them shrink. They lose blood supply, they end up shrinking, and after shrinking, they die off. For this case of Norland, I've been having mothers or people or females with fibroids putting on this pad that has really helped us to make them shrink. So in Norland, we have another special approach that helps people, or that can help females to deal with fibroids. Number one, we have deep cleanser for female. This is a product that helps to prevent the recurring infections in women, which can reduce the risk of getting fibroids. It eliminates vaginal infections. Then with this, we have a lot of a group of products in Norland that have shown that have been proved and have shown an improvement and change, and even have reduced the numbers of people who are going for surgeries, for going for myomectomies and hysterectomies because of Norland products. Here we have Norland Female Pack. In Female Pack, we have Detox, which takes away the toxins from women, especially for those women like here in Uganda have a habit of women expose themselves to self-medication. They take, for example, here they use a lot of tablets that that stops them from conceiving. So when they overtake those tablets, they get predisposed to these problems of fibroids. So usually when you take a detox pack, when you detoxify, then that means it is possible for you to get better because the toxins will have gone. Then we have another pack of female pads. Female pads help us to balance the hormones. After balancing the hormones, you get normal hormonal levels, and usually where these fibroids may not survive, especially when the hormone, estrogen hormone, balances with progesterone hormone, then the fibroid cannot survive. That is also helping us. Then we have Immune Plus. Immune Plus improves the immunity, nourishes the uterus, and improves female hormones, delays menopause because it has that capacity. It improves menopausal syndrome for those who get premenopausal syndrome or menopausal syndrome, and it is a good source of omega-3 fat acid, which reduces the risk of heart disease and is osteoporosis, the weakening of the bones, which is very common in women above 35, those who are approaching menopause. Then we have best supplements. It is the best supplement for women with irregular periods and hormone imbalance. In most countries in Africa, to be specific, like in Uganda, some women do not get the foods they are supposed to get. So combining them, getting them in time is usually a problem. So when you think what you are eating is not helping you, help you as a female, what we need to do is to look for an Immune Plus bottle capsule from Norland. You start taking them because you get it already made, and you use it and your body will be at par. You are nourished, and that is very good and very nice for you. As we conclude, let us look at the at sources, what can one do? In Noland, there is a lot that can be done. But to avoid the complications and so many things that can happen to you, Noland has been our best. We have to improve the lifestyle as a recommendation. Usually, it needs women to eat more of the following: fruits, vegetables, fibers, and natural foods. They are very important. Actually, those are the very things that are given, that are packed in the foods, in the food supplements that we are buying. Secondly, we need to reduce on the following: processed foods are not good for us. Excessive sugars are not good for us. The women that are still in the productive age, when we are under lifestyle change, we have to reduce the intake of red meat, reduce the intake of alcohol. I have not seen, I have always not talked about smoking, but usually smoking goes with alcohol. Then we have to exercise daily exercises. I think, Mr. Purika, one time we need to have a session of exercises, because some of us complain of duties, getting very early in the morning and going for duties and whatever. But it is very good to have exercises. Even your bedroom, just near the bed, is enough to help you do some exercises so that you can reduce the risk of getting complications, including fibroids. Also, drinking enough water is also the best, and if possible, using an alkaline cup. An alkaline cup is the best because it neutralizes whatever has been inside or whatever is in your body through water that you have kept there, and you take it slowly by slowly, and you get a release from a problem. Then we need to manage stress. Stress is becoming a very big cause of so many medical issues, especially those who are living in conditions of too much work, too much thinking, worries, and so many other things. So when you manage stress, you will manage other complications of health. Then sleep adequately. Sleeping adequately is still an issue, especially depending on our professions. Because like me who's here talking, I'm already on a night duty, and I'm monitoring some mothers who are in labor. They want to deliver, so I may not sleep until tomorrow. So for those who have a chance to sleep, kindly sleep adequately and go for regular medical checkups. When you go for regular medical checkups, when you reach there for outcomes, it's better nowadays to check your body. They can check your blood. There you check for HIV, you check for hepatitis B, you check for here in Uganda, we also check for malaria, and for other countries where there is no malaria, that's all. Then the blood group, because we eat according to blood groups, our professions are according to blood groups, and the problems that we meet in health are also according to blood groups. So it is very good and recommended that you go for regular checkups. You check your tummy. They put you in a scan, look inside, look at your uterus. You can go for checkup also. They do cancer screening, cancer of the cervix, and that's very good. You must know your blood pressure, you must know your weight and blood sugar. It's very good because when you get to know a problem in time, you solve it in time. Kindly use Roland products, especially the alkaline cap, the Immune Plus, and female pads for all female-related issues, so that you can get rid of problems before they become very big. That's all for now. Thank you for listening.
Wow, what an amazing presentation. My dear friend Annette, thank you very, very much. I know that this is a great sacrifice that you are doing. There are mothers surrounding you that want to give birth, and you have, taken off your time to run, isolate yourself so that you can be able to deliver this presentation. Thank you very, very much. So, ladies and gentlemen, now to hear from you. Doctor, just before you run away, there are a couple of women that want to ask, a few questions. I hope you can allow maybe 5 to ask you, and then you will respond to their questions, and then we can end the session here. So I need only 5 people to put up their hands, please. Only 5. 5 people that want to ask. Okay, I'll begin with now someone has a Samsung SM something. I don't know who this person is. Please ask your question. Samsung SM A256E.
Hello.
Yes, please. You can ask your question.
Thank you so much, the presenter, for such an insightful presentation. I joined a little bit late, but still, if I am repeating it, it will still be to the benefit of all of us. I've oftentimes heard that fibroid is related to lack of adequate sex, something which I did not get it scientifically, but it is in the public domain. And it is believed that oftentimes the female gender who feel they have issues or challenges relating with the male gender are the ones who get it. And it has always been discussed with examples. So I wanted to find out from the technical person that is it true that lack of adequate sex causes fibroids, such that when somebody is to have regular sex, they are not bound to get it? Then, if at all the answer is yes, what action plan are you trying to come up with in the medical fraternity to encourage the girl child that despite having emotional issues with their counterpart, the male gender, still, if you don't relate and you don't have sex in your daily life, you will still have a medical situation which is not conducive or good for mankind. Therefore, regardless of how emotional or disappointed you are, relating with the male gender, religion aside, becomes a prerequisite to a healthy living in the context of fibroids, which is now on rampage and killing every other single girl. Thank you.
Thank you. The doctor has a question. She will respond to the comment. Just for the interest of time, my brother, with due respect, allow me to take another question from somebody else. I have Ruth Katoka. Please unmute your microphone. Ruth Katoka, you have 5 seconds to unmute your microphone, or I pass the opportunity. Okay.
Good evening.
Good evening, Ruth.
Good evening. Good evening. I needed clarity. During the presentation, the doctor mentioned about a pad that needs to be worn, and apparently it, for lack of a better term, she mentioned that it causes the fibroid to die off or to double down. So I was asking, in a case where someone also wants to conceive, once the fibroid is out, but also is trying to conceive, I needed clarity from the doctor. Could that be dangerous for someone, like if there is implantation already? So if the doctor could respond to that. Thank you.
Okay. All right, Ruth. Doctor has picked your question. Maybe let me just respond. Many people are asking in the chat box how to get these pads or how to get these products. We have very many distributors of Noland across the globe. Please get back to the person who invited you and they will direct you to the nearest distributor if they are not distributors themselves. And better still, if you would like to become a distributor of these products, again, the person who invited you will guide you on how to become a distributor. I strongly recommend that if you have liked this conversation, become our distributor so that you can save lives of very many other women. Over to you, Immaculate. Please unmute your microphone. Immaculate.
Okay. Thank you so very much for this presentation, Doctor. Mine is, can a 16 centimeter mass be shrinked using these nourishing healthy pads as you've explained in your presentation? Because currently I have 8 masses and the largest one is 16 centimeters. Thank you.
All right, the doctor has had your question. I'll take the second last. This is Hikaumba. Please unmute your microphone. Changu Hikaumba. Okay, Changu Hikaumba, you have 2 seconds to unmute your microphone, or we pass on the opportunity. I guess her network has run out. I'll pick Stella HK from Lubowa. Stella, please unmute your microphone.
Hello, thank you so much for the presentation. My question is on the pad that was mentioned. How is it used? Is it one per day? How long do you take to see results? Does it have any side effects on fertility? Those are my questions. Thank you very much.
Okay, all right. Lastly, I'll take somebody called Martin Trust. I don't know whether this is Martin or his wife or his mother. Martin, your hand has been up from the beginning. Please unmute your microphone.
All right, thank you very much. And I want to thank Dr. for a very nice presentation.
Please get closer to your microphone. We can't hear you.
Now, can you hear me right now?
Yes, Martin, you are audible now.
I want to thank our doctor for a very nice presentation. Actually, personally, I feel so touched. My question is very simple and short. You know, like some people have been saying that fibroids are on rise simply because some people are using certain family planning methods. Like, as I speak right now, there is a sister of mine who subjected herself to Depo-Provera injection, the one for 3 months, and ever since she administered that injection, she had never gotten her medicine. So, like, I just want some clarification from the doctor. Could that be also one of the causes for fibroids or not? And if the case is yes, what should be the quickest remedy about that?
Mr. Purika, you will summarize for me that question I haven't heard. as if he's in a distance from his microphone.
Equally so, I didn't hear the question as well. Emma, your microphone was not very clear. I couldn't hear the question. Let me take a question from Gesa, and then I'll allow the doctor to respond to these questions. Gesa, please unmute your microphone. Gesa, please unmute your microphone. You had unmuted and then you muted again. Okay,
Good evening. Right. Thank you for the opportunity. Mine is a quick one. Doctor, at what stage or at what size of the fibroid does someone still have a chance to use those products? Because there's a specific stage they will say if you have above 10 centimeters, it is too big, you have to operate. Or if it is this small, you have chance of other alternative. So my question is, at what stage or at what size, how big is a fibroid that your alternatives are only left to surgery, or at what stage can someone use other alternatives? That's my question. Thank you. Maybe in size form, would answer sort of size, centimeters, something like that.
Okay. All right. Dr. Net, please first respond to those few questions or very many questions, and then later on we'll see if we can pick others if time will allow us.
Yep. The first person was asking whether the fibroids are caused by lack of sex. It's not true. They are not caused by lack of sex, but because people have seen those who have no men or those who have not delivered, meaning that they had no adequate sex in there, according to their thinking, have fibroids. But it is not. This is not among the causes, but the predisposing factor is not delivering. Actually, they are so common in many nuns, those who do not deliver. I think that's why even people think that when you don't pray sex, then you get fibroids. No, it's not the cause, except that when you have not delivered, you have high chances of getting fibroids. But sex is really not among the predisposing factors, neither the causes.
Sorry.
Is that clear?
Just hold on a moment. I want to send a message to Marina. Marina, if you're listening to me, the comments you're writing in the chat box are, in my opinion, out of ignorance. Please do not write comments on something you don't understand. The people on this call have used these products. We have tried the products. We trust in the products. And even the person who is sharing is not a marketeer. This is a knowledgeable person. Please don't mislead people with comments that you do not have evidence about. Marina, please delete those comments. They are misleading. Okay. Doctor, please go ahead.
Yes, and the second person was asking Ruth Ruth. She's Ruth. She was asking about the contraindications of pads. These pads have contraindications, but the contraindications are not so many. They are not more than 3. The ones we have confirmed. One should not use them when she's pregnant. So before you use them, you should first confirm whether you're pregnant or not, then use them. The second contraindication is during menstruation. They shouldn't be worn during menstruation because they are supposed to be used outside menstruation cycle. Then another contraindication, which is even very uncommon, is allergy, a reaction. Some few people, like 2 out of 100, have reacted on these pads. We don't know, we have to first do a research and confirm whether they even had those issues before the use of pads or not. But those are the few contraindications, Madam Ruth. Another one has a fibroid of 16 centimeters big. Usually, what is done, she sounds young, meaning that she's still in reproductive age. They can do a myomectomy or they remove the mass. And because there is a chance of the same muscles from the uterus developing more masses, then after the removal of the masses, you can use these pads to stop the growth of other masses. Then we have, she was asking whether it can still shrink. The big one may not shrink, but the small one shrink. But I, as a person, I have seen so many people with masses. What I usually do as a sonographer, I measure the mass on arrival on the first day, then give pads and the whole packet, the whole package of fibroids. Then after 1 month, I redo or I repeat the scan and keep on comparing sizes, not until the fibroid becomes shrunk and it calcifies and it stops growing. I have witnessed that. I have seen it in women. I followed them up for over 1 year and seen them go. For that one who was writing the comments, yes, depending on how big they are, the causes, and other factors may be connected. We have seen these fibroids shrink. So I would ask this one of 16 centimeters to buy like 3 packets of pads and we start. Then after 1 cycle, after 1 month, you go back and they measure. After another month, you go back and they measure. They should measure both the blood supply to the mass, then they measure the size and record. Then you can get back to us and you tell us what next. But 16 centimeters, depending on your size, could be small or not or big, depending on the machine, even the type of the machine. Though the centimeters cannot change. But 16 centimeters, I don't know whether circumference, I don't know whether volume, I don't know what, but still, try them. You try them. You try them when you are not in your peace and you continuously go there as they measure and record, and you will confirm whether it is shrinking or not, but most of them shrink. Then Stella was asking of how to use pads. Pads are used like any other pads. They are 14 in number. You use one each day. You use it, you wear it for 6 hours and you discard it. And you should use one per day, meaning that the whole pack takes you for 14 days. And don't use it when you are in your menstruation periods. You should use it when you are not menstruating. And it should not be worn when you are pregnant. So first use the remedy, then start the business of becoming pregnant. Then Jessa was asking about the management of fibroids, depending on the size. Usually when the fibroid is too big, then they can operate and remove it, depending on the doctor, because we have very good doctors who can remove very big fibroids and still maintain the uterus. And we have those who are sometimes they don't mind, they are somehow careless, they just remove everything and they throw away. But because they grow from the uterine muscle, it's better when they remove the fibroid, what we call myomectomy. Then you start putting on the pads like for 3 consecutive months, so that the growing fibroids can die and the healing can be so accurate. When the healing is so accurate, then the chances of conceiving are very high. And that's all they had asked. I don't know whether we can still connect to Emma.
Okay, Dr. Annette, thank you very much. I am also not sure if we'll connect to Martin, but just Doctor, allow me to give you Annie. Annie has been raising her hand. I put it down, she raises it again. Annie, please just ask the doctor. You are the last person, and then we'll end this call. Annie K. Annie, if you can hear me, please unmute.
Yes, please.
All right.
All right. Thank you so much. Thank you so much. I just wanted to find
Welcome.
out, like, if someone has fibroids that are like 76 millimeters, and that's the biggest, 76 millimeters, 59, then 67 millimeters. Is it possible for someone to use the pad and this fibroid shrink? And also the other question is, I wanted to find out if it's possible to talk to you, Dr. Annette, on a personal, okay, it is related to medical issues, if I can talk to you, or probably having your contact for further discussions in regard to this. Thank you so much.
Yes, Madam Annie. This fibroid is not so big, though it is slightly big. It is moderately big. And even if there is another remedy that or any other further management that should be done, it's better you start putting on a pad so that by the time something is done, then it will have started shrinking. But we have seen them shrink. They've been shrinking. We see them shrink. We have been monitoring these mothers. Sometimes people think that other things are unbelievable. We even know things that can help this so many times, and we know what can be done. But we have even done a research. You get a mother with fibroid, a woman with fibroids, you give these pads, you monitor for 1 year so that what you are giving people is not poison. And for those who are not getting better, actually, they take less dose. If they tell you treatment for malaria is like chloroquine, 4 tablets for 3 days, then you take 1 tablet for 1 day. Don't expect to be among the people that have used treatment. Most of the people that are not getting results use less than required, less than what is required. And my WhatsApp number for private questions is +256 +256 Ugandan code, then 7888 47801. It is +256 7888 47 801. Has Madam Annie heard?
Okay, for the interest of time, Dr. Annette, I ask that you give us probably your closing remarks. The rest of the questions, I think, we'll respond to them inbox.
Yes, Mr. Purika, maybe you share with her my number.
Okay, that is fine. I will surely share the numbers.
Okay, thank you. Is this all? Can we stop here?
Surely, I know that we have stretched you so much. You had a long day and you have given us another 1 hour and a half. Thank you very much, Annette.
Mothers pushing babies. Hello?
Thank Please continue to help the mothers to push more babies. And thank you for coming to save the lives of the hundreds of women that were on this call and those that were represented. Ladies and gentlemen, just a moment of gratitude. I will allow everybody to open your microphone and say thank you to Dr. Annette. Just
Thank you,
Thank you,
Doctor.
Dr.
Thank
Anne.
you
Doctor.
Thank you, Doctor.
Thank you.
Thank you
Thank you so much,
for the
Doctor.
presentation.
Thank you.